It is Wellness Wednesday, and in this sponsored segment this morning, Dr. Ashraf Elbanna is here, orthopedic surgeon at Memorial Healthcare Center for Orthopedics. He's here to talk about treating your spring sports injuries. Good morning to you.
Good morning.
It is that time of year, more folks getting out, playing sports, if you will. You know, what are some of those common spring sports injuries that you see there as an orthopedic provider?
Yeah, thanks for having me, Matt. You know, we're really seeing injuries of all parts of the body, starting with ankle sprains, moving up to shin splints, knee injuries, quadricep, hamstring strains, you know, even shoulder and elbow overuse injuries.
So you see a wide gamut there of those injuries. You know, first off, before we get to treatment, let's talk about prevention. You know, what can people be doing proactively to avoid some of these injuries?
Absolutely, and this is something that applies to both non-athletes and athletes alike. But a lot of times over the winter, we haven't necessarily been as active as we'd like, and then as soon as the weather starts warming up or that sports season starts, we just want to jump right in head first. And that's a surefire way to get either a sprain or a strain or potentially something worse. So it's really important to both increase gradually both the intensity and the duration of the activities that you're doing. That can help reduce a lot of those injuries that we're seeing. There are other things that are also very helpful. Adequate rest is important, just giving your muscles time to recover from those small injuries that occur with, you know, normal day-to-day activities. Adequate sleep, nutrition is important as well, staying hydrated. All of those are key to injury prevention.
Okay, so a collection of things there you can be doing when you're kind of easing out of hibernation, if you will.
Absolutely.
Let's talk about, though, if you are injured, you know, when is it important to seek medical attention and get in an evaluation? What will you do?
Yeah, so a lot of times, you know, with, you know, minor injuries, we pretty much want to stick to conservative management, which will include things like rest, ice, compression, and elevation. It's that mnemonic RICE. And if you attempt those activities and you're still having symptoms after 2-3 days, that's when you want to seek orthopedic consultation with our specialists, which we have a walk-in clinic available 5 days a week, or you can seek care from your primary care physician who can send you over to us.
Well, and talk a little bit more then about the intervention itself and treatment options. There's a wide array of things that you can do to help people out.
Absolutely. So, you know, the injuries will fall into one of 3 broad categories. We'll see acute injuries, which is when you know, trip and fall and either break something or tear something, or you'll see an overuse injury that's just due to repetitive wear and tear from using the same muscles and tendons over and over and over, or you can see kind of a combination. So a lot of the treatment options will vary depending on kind of which bucket the injury falls into. For some of the acute injuries, you know, they may require surgical intervention if it's not responding to conservative options, but for a lot of the overuse injuries, a lot of times we're recommending that patients rest, you know, take a break from their activities, whether it's a sport or something else, and try those other conservative options.
But bottom line, they're in good hands, right?
Absolutely. We're here to take care of them.
That is wonderful. And, you know, we appreciate your expertise and insight this morning. And for more information, you can go to the website there on your screen, memorialhealthcare.org. And thank you again for coming in, and be safe out there, right?
Absolutely.
All right. Thank you.
Thank you.